Today we're taking a look at class 1 antiarrhythmic drugs. These drugs act on the sodium channels of the myocyte cells. And quinidine is one example of a class 1 antiarrhythmic drug. Normally, sodium flows into these transporters and enters the myocyte during depolarization. But the class 1 antiarrhythmic drugs blocks this. And if you remember the action potential graph of the myocyte, it starts with phase 1, which is a rapid increase of sodium. So by blocking these channels, this phase becomes prolonged, and depolarization therefore takes a longer time. Now let's zoom out and see how this affects the myocardial tissue and the heart rhythm as an effect of this. And as you probably already know, the large effect of this drug is to lower the heart rhythm. But let's take a look at how it achieves this in more detail. So first, we'll look at the normal conduction system of the heart. The electrical signal starts from the SA node and travels through the atrium to the AV node, and then through the His bundle down into the ventricles. But sometimes there are these accessory pathways, shown here in orange, and in this case it connects the ventricle with the atrium. First, we'll see how the electrical signal would travel without this accessory pathway. And for simplicity's sake, we'll only look at the right side of the heart. So some of this electrical signal can travel through the accessory pathway and then through the His bundle again down into the ventricle. And this stimulates extra beats of the heart, and it would in this case give rise to a atrioventricular reentry tachycardia, or AVRT for short. Now we'll compare the conduction system of a normal heart compared to one with this accessory pathway. And we'll look at it side by side and see the difference in heartbeats. Now let's take a look at how class 1 antiarrhythmic drugs can break these reentry tachycardias. When the signal from this accessory pathway reaches the atrium, the myocyte cells needs to be in a repolarized state to be able to be depolarized by the signal and through that mechanism spread the action potential through the atrium back into the AV node. But the class 1 antiarrhythmic drugs prolongs depolarization, and because of that it takes longer for the cell to reach a repolarized state. And so the idea is that when the signal reaches the atrium through this accessory pathway, the myocytes here are not repolarized, and therefore the signal breaks. And as a result, we can slow down the heart rate and break the arrhythmia. And that covers everything for this video. I hope you learned something and thank you for watching. And please consider joining the Discord server if you're interested.